Let me go back 30 years. It's the first time I had my own office. I'm a second-year fellow in child psychiatry. My office is so small that when you open the door, I have to close the folding chair so in this case, the father could come in the room. I then close the door and open the chair, and he sits down. And I remember this is 30 years ago because my daughter's 31 and she had not yet turned 1. And this guy that I'm talking to is a used car salesman from Las Vegas. Single dad, mom had left home. This is the only son that we're talking about. He's a 12-year-old who came from Vegas with an acute psychotic episode. And I'm giving feedback to the dad. And 30 years ago, I was actually really smart. I knew everything about nucleus accumbens and anticholinergic and schizophrenia and first onset psychosis. And I start telling the dad all the stuff I know. And the dad looks at me and he says, "Hey, doc, are you telling me I need to build a room out back?" And I just started to cry. And I realized that the trajectory of this family's life had just changed dramatically, and I was being a jerk. I was talking medical. I wasn't talking to this guy the way I would want to be spoken to if something, God forbid, happened to our little infant at home. In that case, and another case of a third-grade girl who wrote that she wanted to kill herself. She wrote it in a poem, in a haiku poem, that the teacher read at night, and then this is a couple years later in my training, and the teacher told the principal, and the principal called the mother and the father, and this was LA, and so if you want to get in to see a child psychiatrist, you have to know somebody. So this family knew somebody, and because of that, they only had to wait 3 weeks to get in to see me. And I thought from those two cases, I got to talk to people in a way they understand. And if my kid's suicidal, I shouldn't have to know anyone. I should be seen today. And so that's all I've been trying to do. I had this great opportunity at UCLA with an amazing team, and we took patient satisfaction. Basically, we created same-day access from 28th percentile to 99th percentile. So we became the most, I then went to business school. We had the best NPS of anyone. And then I went to Geisinger, and Michael mentioned it earlier because about the payer side. I went to Geisinger for the wrong reason. I went to Geisinger because I wanted to learn the insurance business, and I thought, what a great place to do it. I did learn the insurance business. But what I learned more importantly was not that patient satisfaction thing that I focused on at UCLA, but what do you do when you literally fall in love with your community? And the reason Geisinger was so innovative was not because the people of rural Pennsylvania are cutting edge. It's because the people of rural Pennsylvania love their friends and neighbors. And I mean really love it. And so because we loved one another, we made an insurance plan that they could afford. That's why Geisinger got into insurance. We created the largest biobank in the world of whole exome sequencing with return of results, not because we were into genetics, but because if you have a stable population that's not going to move, and they have familial hypercholesterolemia, you can save half the family by knowing that information. And then my wife, who thankfully follows me in all these jobs, created the Fresh Food Pharmacy, which was giving fresh food, which we'll talk about later tonight, to type 2 diabetics. And it was 2.5 times better than metformin. Hemoglobin A1C dropped by 2.1. If food were a pill, it's a multi-billion-dollar pill. We saw costs of our diabetics go from $130,000 down to $40,000 in 3 months. And then I went to Google, and at Google, I was so scared. I was scared that, first of all, you're surrounded by people that are so much smarter than you are. Like, this is the first time I had imposter syndrome with like a capital I. And at Google, I was nervous that the people in the for-profit world, I'd never been in it, would somehow make me not be able to follow my values of putting patients first. And what I found was these people in the for-profit world were more mission-driven than anything I'd seen at either UCLA or Geisinger. They were more focused on health inequities than anything I'd ever seen. So that was great. The other thing I learned at Google, they show this slide, and it has, I forget how many, but I think it's 11 products. And they go, these are the 11 products in the world that have 1 billion users each. And then they click to the next slide. And 7 of them are part of Google, right? So Photos, Android, Gmail, Search, YouTube, Waze, right? Maps. And they basically said, here's all the money you ever could need, the smartest people in the world, go do a health thing that has 1 billion people. And what we did instead, and COVID helped, was try to make those 7 things better for health. When I left Google, our YouTube information page had 50 billion impressions, 50 billion. It's now 80 billion. And all of those products had one thing in common. They were helpful. You will give Google, or any of these big tech companies, all your information if they help you along the way. Like, I'll put in, I'm here, and I need to get to LaGuardia. It'll tell me where to turn. It'll tell me how many minutes, et cetera. But if I'm diagnosed with breast cancer, nobody gives me directions every step of the way, right? There isn't that kind of helpfulness when you come into our world in healthcare. I kind of missed walking in the nursing station in the ER, so when Cerner called, even though I knew it was a industry that hasn't made docs happy, I was like, I want to get back to it. Cerner's the biggest EHR company in the world by far, way bigger than Epic if you look at global market share. And what I've said to the team there is, that means we have more grandma's blood sugar than anyone else. So if you have grandma's blood sugar, what do you want to do with it? The first thing is we should keep it secure. And then we got to get it to the right place. And then we got to make sure, does grandma have food in the cupboard? Does she have a sore on her foot? How does her retina look? Right, that's the privileged space we're in. And then, a little short in my tenure, Oracle reaches out to buy us. And I thought, oh no, here we go again. Tech company coming into healthcare. And when tech companies come into healthcare, they make 2 mistakes. 1, they have lack of humility. And 2, they have, and we heard it before, they have point solutions instead of thinking about a platform. So they give you a lot of money to stay for 1 year. And during that year, there's about 4 or 5 decisions that Oracle makes that says to me in my mind, here we go again. Like, they don't get it. During that year, all of those 4 or 5 decisions, Oracle reversed. So now I'm 2 years into Oracle. I said, I want to stay. This is fantastic. And what are we trying to do? And it actually leads to why I'm here today. So a couple things. We're trying to completely fix the EHR. So we now have an ambulatory product where you would see your patient that has food insecurities, post-pneumonia, you're checking on them, you want to check labs, you never touch the computer. So we're not going from 50 clicks to 30 clicks, we went to 0 clicks, fantastic. And more importantly, it's the only industry that doesn't have a platform across it. So in addition to EHR, and now everything I'm talking about is EHR agnostic, we have cloud-enabled technology that brings together human capital management, supply chain, ERP, claims processing, clinical trials, things that Oracle had already done in health, all together so it's clinically informed. What does it mean? It means when you go into one of your health systems right now, and a nurse on the floor is a traveler or a floater, and they're asked to give chemotherapy, they might have been certified in it 2 years ago, but they've never given chemotherapy. We need to know from human capital management that that's happening and do just-in-time training in the EHR. When you're done in the OR, that has to not only use ambient to dictate your note, but to drive your supply chain and make predictions about what we need in the OR tomorrow, right? So that's the whole piece. The same with financial services. So I could do the whole Oracle spiel. But the last piece that we say is that we want to build this end-to-end platform in healthcare that's cloud-enabled and secure, that's open and connected, and we want to do it with partners. So what does all that mean? Open and connected means different than Epic. We want to literally open up all the APIs so the innovators can get into the EHR and get into the workflow so the innovation happens with all of you folks. And through partners, and to me this is really important because I think it's code word for we're coming at this in the most humble way possible. There is no way we can fix healthcare, any of our organizations, by ourselves. There's no way. It has to be through partnership. And when I think of what I've had this amazing opportunity to see healthcare from so many different angles. I provided care. I've worked on the provider side, the payer side. I'm on the Humana board. I'm on the Edwards Life Sciences board. I've seen healthcare from the tech angle. So when people talk about different parts of the elephant, I've seen, I think, many parts of the elephant. And when healthcare works, it's people caring for people, and it's based on trust. I mean, fundamentally, that's the business. And the tech should simply be in the enabler. And when healthcare doesn't work, it's usually one of two things, and sometimes both things, that got screwed up. It's communication and coordination. I did not communicate right to that dad of the kid with schizophrenia. We certainly didn't coordinate right when it took 3 weeks and somebody to make a bunch of phone calls to get their 8-year-old in who wanted to kill herself. And those stories are replicated. They're being replicated at your health systems right now today. I am positive that there are people that are trying to access your system and really should have been seen tomorrow. So what's the tipping point? The tipping point is if I could go back in time, I would have loved to have care to help me get the patient in. Ascertain, to get the pre-approval for the patient who needed 2 more days in the psych hospital. To have Optane to help me with diagnostic accuracy. And to have Hume to be able to help me understand from an emotional standpoint when somebody calls any of these systems or any of these places, that we answer in a way that says, we've been expecting you, and we're delighted to take care of you, right? So when you think about that, and now let's fast forward to the next 20 companies that John and the team develop, these are all amazing tools to allow us to actually coordinate and communicate care in a much better way. So I don't want to be a downer, but you now have tools that I didn't have. And they're at your disposal. The folks that we've heard speak today, all of you and the dignitaries, have had, I think, some things in common. We've seen passion. We've seen humility. We've seen integrity. We've seen bold leadership. Bottle that up, take that home, and go do your thing. Because there's a bunch of friends and neighbors that need what we're doing. And they actually need it yesterday. The AI piece is a pretty cool tool that I think can help us accelerate some of this. We need to be a little careful that we don't create more problems with it. But it's a pretty powerful tool that I haven't seen anything like this in a long time from a tech standpoint. So it has been a real privilege to be able to learn from all of you over the last 24 hours. We got 2 more really exciting things happening. We have a special guest, I think it's plural, special guest that we'd like to introduce you to when you go out to the wine and cheese, so don't disappear. And then the highlight, if we really, really want to fix healthcare, the guy who knows the answer is going to have dinner with us tonight. And, you know, when people talk about how do you want to drive down healthcare costs and improve quality, if we did what Dean has been preaching for 47 years or something like that, it's actually stuff our moms told us to do. 50% of your census would disappear overnight. The economy would totally take off because as healthcare costs dropped, we'd see an increase in wages and all the things that we've been missing. More money for schools, more money for roads. So I think the highlight is yet to come. And I hope you've enjoyed today and last night as much as I have.